IVF Serum was established in 1989 as a family-oriented medical facility. It embraces, supports and guides women and their partners through their fertility program, and this overriding commitment to the patient has made IVF Serum a pioneer in every facet of the fertility challenge. The clinic has a long-established international reputation for combining the latest in medical advances with a passionate dedication to the nursing of patients. Establishing a strong personal relationship with patients allows the clinic to deal with and anticipate all types of pressures and anxieties, fears and frustrations. This allows the patients to relax and recall medical conditions which may be vital to creating a customized protocol of treatment.
"26 years ago, we decided to create a clinic that will be based on our care and love to people. The vision of all this was a perfect environment, both to people working in the clinic and to the people that they will come for us for achieving their dreams. I believe that it is very, very important for every human being to become a parent. And for this particular reason, we wanted to offer every possible thing that we can offer in order to achieve their dreams. IVF is not just a technique, it's also love and care. And we do believe that without love and without care, even if the techniques are perfect, the result is not what we want. Infertility is when a couple is trying to achieve a pregnancy for about 1 year and they don't make it. Obviously, for having a healthy baby home, we need sperm, we need eggs, we need a good uterine environment. And when we are starting investigating about infertility, we focus on these 3 parameters, and we are trying to connect all of them together, because all of these things have to be okay at the same time, and make it happen. There are many tests, there are many approaches. Some of them are very easy, some of them are more advanced, but in very simple words, there is not really infertility in nowadays. There are only very, very little couples that with the right help, they cannot make their dreams come true. Practically, even if 20–25% of the population do face fertility issues, only 5% end up with not managed to achieve their dreams.
Here at Serum, as an international patient coordinator, I'm responsible for providing our couples with their medications or any prescriptions if they prefer to buy their medications from home, answering all the queries they might have, and make sure that this procedure is as stress-free for them as possible by helping them with their accommodation, their transportation. We want to develop a very strong personal relationship with them so they feel like family. We really believe that all our couples should feel like home when they're here at Serum. You should choose Serum because treatment here is friendly and stress-free. It helps you to cycle with people that are warm and positive and always looking for solutions to your fertility issues. At Serum, our only motivation is to try and get a highly specialized and individualized treatment for everyone. We create protocols that are tailor-made to our couple's needs. We try to avoid the production-like attitude. Instead, we listen to the stories of our patients. Our clinic offers rapid access to tests, consults and treatments. As a result, you will only need to make 2 visits. We will do all the necessary investigations and provide you with most of the results on the same day, so you can make decisions about your future treatment. Greece is a very attractive destination for IVF because combines high success rates, tempting prices, friendly people and a variety of choices for vacations and sightseeing. I would like to add that we collaborate with a travel agency that can book your accommodation and schedule nice excursions in Athens or to nearby islands.
If we're going to start about diagnosis of infertility, there is a variety of tests that you can do. Usually you divide these tests between those investigating the male factor and those that investigate the female factor. And universally, the first thing to do for male factor is to do a semen analysis. We always integrate a DNA fragmentation evaluation test for the male factor, which is a test that evaluates the degree of fragmentation in the sperm of the genetic material of the sperm. And this is quite crucial because we've seen through the years that sperm that has a higher percentage of fragmentation is not able to give us embryos that are going to fertilize well, and they're not going to proceed well with implantation or a pregnancy. Now, when it comes to female investigations, of course, we start with a hormonal profile that includes the basic female hormones that we need to do before any fertility treatment. But also another part of it is the anatomical investigation that has to do with a scan, an ultrasound scan like this one. And it is used to evaluate the anatomical condition of the uterus, basically make sure that everything is normal inside the internal genitalia of a woman. And you have the standard gynecological scan that you perform in every unit, but also you have a very detailed scan that has to do with injection of normal saline inside the cavity. We call it aqua scan. And basically, it's a much more detailed scan that gives us a lot of information about the integrity and the condition of the uterus inside after we have injected normal saline. So it gives us information about the existence of polyps, fibroids, adhesions inside the uterus, cysts, other stuff as well. So it's quite an integral part of our investigations in the female partner. What makes Serum different than other centers that investigate couples before the start of IVF treatment is that we are absolutely determined to do 3 tests to every couple that's going to have some sort of IVF treatment. The first one is to do menstrual period cultures. This is a way basically to investigate for the existence of subclinical infections in the uterus. Subclinical means that there are infections that run without giving any symptoms to the woman, such as pain or fever or discharge, but a woman can have it for years without knowing about it. And if you have an infection like that, then all the efforts you do, either trying naturally or through IVF, are going to fail. And basically, you're going to end up with a problem that's most units would call it unexplained infertility, but it's not unexplained. There is a reason behind it. It hasn't been investigated well, that's the thing. The other thing that we do is we are very, very strict on investigating every couple for immune issues, because we have seen through the years that there's a lot of couples that everything is fine, but they fail to conceive because of severe immunological problems that lie underneath their efforts. So we do a very, very thorough investigation of immunological issues that could stop them from getting pregnant. And if something is found, then we have a lot of protocols, a variety of protocols that can deal with that. The third thing that's quite important for Serum IVF, the way we do things, is that if we see something that through gynecological scan or aqua scan, that's something wrong inside the uterus, then we are very strict in proceeding with hysteroscopy. Hysteroscopy is basically a minor surgical procedure that involves a small camera going through the vagina inside the cervix of the uterus. And this way we can actually visualize, we can see inside a woman's uterus to make sure that everything is fine or to see if something is wrong. And at the same time, it's not only that we can see, but we can treat. So if, let's say, there is a fibroid there that has not been diagnosed before, or there is an adhesions that can stop a woman from getting pregnant, during hysteroscopy we can not only see it, but treat it as well as a day case procedure. Where lies a problem, always exists a solution, and we have a variety of protocols and treatments. And our goal is not to basically categorize the patients to the protocols that we have, but the other way around. We have a variety of protocols that we can change, we can be very flexible about, and depending what the issue is behind a couple's infertility, then we can adjust them accordingly.
Going to Serum, I was given such a huge feeling of positivity, commitment and care from Penny and all of the team, and a real sense that achieving a pregnancy could happen, regardless of the statistics of people trying IVF beyond the age of 42. I think the things that made it work were the skill of putting together the different protocols, the skill of the embryologists, the open, flexible approach, and really that every challenge was embraced with a smile and they weren't going to be defeated. But it worked and I had my baby and he's one and gorgeous.
I ended up finding Serum after 6-7 years of infertility here in the UK. We'd had 4 IVFs, 2 miscarriages, many problems with endometriosis, and was just getting no help. In the end, I sat in an office with my gynae and I was told that I would never fall pregnant with my own eggs and that I needed a hysterectomy. That's all they could do for me now. And I think that shocked me into finding treatment elsewhere. After a lot of research, I found Serum. We spent time sort of changing the drugs, seeing how I responded. I was quite a low responder, so she had to adapt and change the protocol somewhat. And on that protocol, I got a chemical pregnancy, which gave me a lot of hope, actually. It was the nearest I'd got in like 9 years of trying. I remember her taking my hand in the changing room and just looking at me, and she said, you know, I will get you your babies. If you want 1, 2 or 3, I will get you your babies. And you know, you just don't get that anywhere else. There's no other consultant that I've ever seen that literally just wants her ladies pregnant, as she puts it. You know, it's not about money. I mean, obviously they are a business and they've got costs, but to her it's not about money. It's about, you know, getting you a family and getting you your babies. After 10 years of infertility and numerous cycles, a lot of money, a lot of heartache, we now have a 16-month-old daughter, a little boy on the way, and there is just no way that I would be in this position if it wasn't for Serum and Penny Abatzi. Just no way whatsoever. I mean, I can't even thank her. Get emotional. I can't thank her enough.
Couples that they go through fertility treatments many times have a very hard way, a very hard journey. I want to tell to them that never to give up. It is so important to keep on trying till they achieve their goals, because their goal is life, is happiness, is everything they are looking for after all. At Serum we believe that IVF is life, and life actually is love. So we are trying to offer happiness and life to all these couples that trust their dreams to us. And this is rewarding for us and for them.
Changing lifestyle